Hi, and welcome to this short presentation on the use of DHIS2 analytics. In this presentation, I will go over a few of the concepts of how data is processed in DHIS2, how it can be entered and accessed for analysis and interpretation. So as you might know, DHIS2 is an open and interoperable platform, which means that the system itself can work with other existing systems. As you can see on the slide, the DHIS2 capture apps can be used on various devices, and we've currently been using a web browser interface on a notebook or desktop computer, but you can also enter data using a Android-operated app on your phone or using SMS. It does allow also data entry via other transactional systems, for example, medical records or human resource management systems, or even mobile collection, such as the Kobo Toolbox, which many people are familiar with. Now, the data repository, which is fed by these different sources, can be managed through the web browser and accessed via web APIs. So these are addresses which you can use in external applications to pull data from your DHIS2 in other systems and applications, such as R statistics for statistical analysis, or it's even used within the DHIS2 for its own visualizations, or another option like the Google Maps. So what types of data do we use within Ascent? So as you might recall, in DHIS2 there are three different types of data. One is the aggregate data, which is the classical format in which data are entered in, for example, facilities, and they're aggregated up the chain. These are data which come in on a routine basis, for example, monthly entries, which are managed in data sets. The other one is events, which can be entered at any time, so doesn't necessarily follow a logical time sequence. You could think of facility assessment or clinical visits or an educational event, so all event-based. And the third one is tracking. This is individual patient-level data. So, for example, to be used for provider follow-up with individuals, maternal health applications, or also supply chains such as equipment and drugs. So within Ascent, we only use the events data type for our MBA, DSA, and MMBP campaigns data capture. So we're using events as the data type for our program. So as said, there's many ways of feeding data into the DHIS2. I've mentioned the Android app on which you can use on your phone or just by logging in using a desktop computer. But there's also SMS or even USSD, which is a real-time network connection, which can be used to connect to your DHIS2. Now, in the events report or the event captures which we do, we try to mimic the data sequence as you would use in the field. So on this slide, you will see on the upper left a tally form which we would use in an MDA event, which can be translated into a Excel-based data sheet in which every event would become one single row, and the different columns represent different indicators for that specific event. And that's exactly how you've been capturing the data within the DHIS2 for Ascent using the event capture forms. Now, events can be different entities depending on your type of intervention. So, for example, for an MDA, you would expect one event report for an IU for a given year for a specific NTD. For a disease-specific assessment, you might have various sites, so multiple sites being reported for a single IU per survey. And finally, for an MMDP report, you can have one or more reports per IU for a specific month. So it depends on the type of the intervention, what one event report represents. Depends on the frequency of data capture and the number of sites for which data can be captured. Now, when we look at the analysis of data and events, it is fully integrated into the DHIS2 analytics package. So we have routine data coming from your aggregate data or the events which we're currently entering, or the tracking data if you're reporting on individuals. These all can be used within various applications on the DHIS2 side to visualize them. So in our case, we're using three different types of analytics. One is the mapping app, which is used to visualize aggregated data for one or more programs. So these can be indicators or data elements. So different data elements can be combined into an indicator, and these can all be visualized onto a map. The second one is event reports, and this is really used to create a line listing of different events. So for example, if we would have an IU where there have been 5 consecutive years of MBA, we could use a line listing of these different events, so these 5 records, each for each MBA 1 record, and we can line list them into a table. And we use the event report application for that. And in this report, we can then display or summarize different data items or program indicators. And the third one, which we will use, is the data visualizer. And this is actually the one which will be most often used. And the data visualizer can be used to show aggregated data for one or more programs into a single chart. So where the event report is limited to one specific type of program, for example, LFMBA or MMTPs for Tacoma, in the data visualizer, these can actually be shown side by side. So you could, technically speaking, show your LFMBA results together with your MMDP for Tacoma results onto a single graph. So I said the DHIS mapping application has been already integrated into the DHIS2, and it's used on our current dashboard. This is very useful to show results, for example, as you've seen here, for the results of a disease-specific assessments, in which you can map onto a base layer the specific geocode locations of places where samples were taken for this specific assessment. This is an example of an event report. So as mentioned, a line listing of different events which are reported for one or more IUs, depending how you filter your data. And finally, the data visualizer showing graphs of your different data elements which have been collected via the event reports. And all of these together can be combined into a dashboard. So all the different charts, maps, and tables can be added to a standardized dashboard. So they're automatically populated each time that you open a dashboard. So this is very useful for program managers and other decision makers to quickly get an insight into the data which is stored within the system. Finally, the full set of analytics also has some functionalities which can help surveillance. So, for example, you can make predictions for generating future data. You can have schedules, so you can time schedule your validation job, so when you would look at specific elements. You can add alerts and notifications on SMS and email, so that different users to the system get notified when changes have been made to the data, for example. And you can add events, for example, for outbreak management. So even in the analytics tools themselves, you can set up different alert systems which will trigger a message to be sent to any of the users inquiring or asking them to come to the system and for example, have a look at some specific pieces of data. Thank you for joining this presentation. I hope you enjoyed it. See you next time.